Hello, this is Paula Anderson, and this is another class that we're going to have on modifiers. So, this is kicking off our lesson on the surgical modifiers. So, we're going to go over a few modifiers and give you a little understanding of what they mean and then also how they are used. So, in your CPT manual in Appendix A, you have a full list of the CPT modifiers, and you also have a few Higgs-Fix modifiers as well. So we're going to focus on the modifiers that you will commonly see used in a surgical setting. So the first modifier is going to be modifier 52, which is reduced services, and that means that the procedure was not completed. So there could be a number of reasons why it was reduced. It is left up to the physician's discretion in order to make a determination that it is a reduction in the services. Now, also, you want to make sure that if there are any guidelines from a specific policy, that you follow those policy guidelines from a payer. The next modifier is 53. So modifier 53 means that it's a discontinued procedure, and this is normally used when the patient's health is being threatened or in jeopardy. So you want to make sure that you read the operative report to determine what is causing the patient's health to be threatened. So that could be obesity, that could be elevated blood pressure. So anything that's medical that's going to prevent the patient from having that procedure, you would use modifier 53. The next modifier is 54, which is surgical care only. So normally when a physician does a procedure, he or she normally does the pre-op, the post-op, as well as the intra-op. So they will do all three parts. But this is the modifier that's used when the surgical procedure is only done by the physician. So it's modifier 54. Now, you have two other modifiers, one for the pre-op and the other one for the post-op. So that's going to be 56 and 55. So you want to make sure that if you're applying these modifiers, it means that the surgeon is actually separating those procedures, meaning that one doctor is doing the post-op, another doctor has done the pre-op, and then one doctor is doing the surgical procedure only. All right, so next modifier is 56. So I'm sorry, it's 58. So 58 means that it's a stage or related procedure that's being done. So the surgeon knows in advance that he or she is going to have that procedure done. And so there are several examples, but the example that I will give is an example that I used when I was coding integumentary. So if you have a debridement that's scheduled, so on day one, they're going to do the debridement, and then a couple of days later they're going to schedule another debridement. So depending on whether or not the procedure is 0 to 10 days or if it's 90 days. So modifier 58 indicates that it's a stage or related procedure. So you want to be careful and make sure that you follow the policy guidelines before you make any modifier assignments. The next modifier is 59, which is distinct procedure service. And so this modifier indicates that there's something distinct about what you're doing with this procedure. So it could be at a different time, it could be a different incision, it could be a different structure. So you want to make sure that you have specific reasons as to why it is considered to be distinct. There are four Higgs-Fix modifiers that are used in order to describe the modifier 59 situation. So you have XE, XP, XS, and XU. And I'm going to give you an opportunity to look those up on your own. So the next modifier is 62, which is two surgeons. And so that means that you have two doctors that are working as primary surgeons. Both of them are going to get paid a percentage for their particular procedure. So modifier 62 indicates that it's two people. And you want to make sure that the person that's billing modifier 62, that it goes on both doctors' claims, because if it only goes on one doctor's claim, then one doctor is not going to be paid. And so that's going to create a billing error. So you want to make sure that you understand the guidelines for that. The next modifier that we're going to talk about is modifier 63. So modifier 63 is surgical team. And what that means is that you have multiple doctors that are working on a case. So it has to be at least three or more. So think about procedures that really do require more than one physician in order for them to be carried out. The next modifier that we're going to talk about is modifier 78, which is return to the operating room. And this modifier is based off of the patient having some type of complication. They had some type of infection. So think about if a patient has to come back to their doctor because of bleeding, then of course that will be considered to be a complication. And then the last modifier that we're going to talk about is 79, which is unrelated procedure or service by the same physician. So you think about a patient that had a cataract procedure done today, and then 30 days later, they're going to schedule that patient for the second cataract procedure that's going to be on a different eye. So they did the right eye today, they're going to do the left eye 30 days later. So this is when you would need to use modifier 79 if the same physician is going to be doing both procedures. So the modifiers is very important when you're trying to prepare for the CPC exam. You want to make sure that you have a very good understanding of what they mean and then how they're applied. So one of the things to consider is that doctors are not going to write, okay, this is a reduced service. They're not going to write that down for you to signal to you that you need to add a modifier. You're going to have to actually interpret that from the dictation as to what it is that they are trying to do. So stay tuned for more videos from Paula Anderson Coaching Consultant on coding. And I look forward to working with you in one of my courses, whether it would be medical coding or medical billing. Thank you so much, and I look forward to working with you.